Hi, my name is Myra, and I'm here to talk to you about a very interesting article that I was able to find on an American Journal of Epidemiology. This study was basically conducted here within Northern California on Kaiser Permanente population only. So the title of this journal was Immunization and Bell's Palsy in Children. The researchers were trying to prove to see if after the immunization of the TIV, HPV, and also the flu vaccine were causing children to be diagnosed with Bell's palsy within 1 year after the administration of the vaccine. This study was actually interesting and brought my attention due to the fact that I normally hear how Bell's palsy is being diagnosed in adults and not in children. So knowing that children also are capable of getting Bell's palsy brought my attention, and I thought it would be very interesting to read the article. So, like I said, let's go a little bit behind about the history of Bell's palsy. What is Bell's palsy? Well, Bell's palsy is an acute idiopathic and usually unilateral paralysis of the seventh cranial nerve. Most of us might know it as the facial nerve. When a patient presents with symptoms of Bell's palsy, they have limited movement of the forehead, drooping of one side of the face. They are unable to close their eye. There's a decrease in tear production. Sometimes a patient might talk like only moving one side of the face due to the paralysis of this face. So it could be very, very devastating and frightening if a child presents with an abrupt onset and a rapid progression of this disease. So the theory behind this phenomenon and vaccinations is that vaccines, after receiving vaccines, they produce antibodies, and somehow some antibodies that are produced attack the normal cells, such as those cells on the facial nerve, which produces this palsy. That way, treatment of Bell's is to suppress the immune system by steroids, usually prednisone, to stop the antibody from attacking the nerve cells. So this study was basically conducted between the time period of January 1st, 2001 through December 31st, 2006. So how did they gather their information? So these researchers pretty much took medical records from previous children that were vaccinated within a year. So here were some of the requirements that they had unable to choose the files that they would have to review. So they took 977 children ages 18 years or younger and had diagnosis of Bell's palsy. Number 2 was following review of 119 children were rejected. In addition, 36 children were excluded because of the history of previous Bell's palsy. Children had to have received at least one immunization during the 12 months prior to the onset of Bell's palsy. These were some of the criteria that some patients had to meet to be able to qualify to be part of the study. There were also 3 key techniques used in this study. And like I said previously, one of the key terms was they must be within the population of the Kaiser Permanente. Number 2, it was they had to be 18 years and younger, and they also had to had all the diagnosis, the proper documentation stating that they were fully diagnosed with Bell's palsy, and they also went through the diagnosis of ensuring that they did not have nerve damage before they actually got the actual diagnosis of Bell's palsy. So the findings that are straightened this study was they were able to deal with a large population, which is good because sometimes some of these studies, when conducted, sometimes they're not good because it's such a small group that there's just not enough studies, or I should say results, to be able to come out with a big, large number. So the case had to have been continuously enrolled, and also comprehensive chart reviews, like I said prior, were conducted to extract information, and they also actually had a otolaryngologist, if I'm pronouncing that right, review all the cases using a case deposition form and putting the patients in categories. And the categories were definite, probable, or rejected. The researchers, when they did the statistical analysis, they used a novel case-centered analytic approach to evaluate the association between immunizations and Bell's palsy. In the current study, the case-centered approach examined whether a higher than expected proportion of the case received the vaccine during a pre-specified risk interval. To conduct the analysis using this approach, they included in the analytic data set only cases who had received at least one immunization on observation period of 1 year prior to the onset of the Bell's palsy. So again, they had to be very strict on how they were able to choose their patients on the case study. Also, the strains, like I said prior, was to have a large group, but they also had some weak areas in the study. So this study had some things that could have been improved that would have given the researchers a better result. First, the number of cases who had received the intranasal vaccine was too small to allow them to examine association between the vaccine and Bell's palsy. Second, they had no clarification whether the diagnosing doctor had tested all movements of the face, as if all the children had the same physical assessment. So pretty much these patients were not all assessed by the same physician, so they were not able to see if all the doctors assessed the correct way in all the areas that everyone should have assessed the patient. So the conclusion to this research study was that after 1 year on study, there was no association between vaccines and Bell's palsy during the periods following immunization by either 1 or 2 months from administration. So pretty much all our vaccines that we give our children are being tested every year for safety. Yes, as parents, we might be worried of the side effects, but every medication has side effects, and I believe that not vaccinating our children are actually going to cause a bigger harm to our children, because they're capable of catching the viruses, the bacteria, the diseases out there that are not curable once received, or they might even die if not receive the vaccination. Once again, I believe that this was a very interesting study due to the fact that Bell's palsy is not seen in children and only in adults. Thank you.